Understanding the role of vitamin D3 and vitamin A in cancer prevention and treatment. Disclaimer: the information provided in this video is for educational and informational purposes only and is not intended as medical advice. The content discusses findings from various clinical trials exploring the potential role of vitamin D3 and vitamin A in cancer prevention and treatment. Always consult your doctor or a qualified healthcare provider before starting any new supplement or making changes to your healthcare regimen. The creators of this content do not claim to offer medical guidance or guarantee outcomes based on the information shared. Viewers are encouraged to perform their own research and speak with a medical professional regarding any health-related concerns. All the information in this video is backed by clinical studies, and the topics I will be covering are as follows. 1. Role of vitamin A and vitamin D3 in cancer prevention. 2. Therapeutic role of vitamin D3 in colon cancer. 3. Therapeutic role of vitamin A in colon cancer. 4. Why is it important to supplement vitamin A and D3? 5. Recommended dosage. 6. Impact of gallbladder removal in absorption of fat-soluble vitamins. 7. Supplements and enzymes for improving fat. I will also be covering the following clinical researches that have studied the therapeutic effects of vitamin D3 and vitamin A in colon cancer. 8. Clinical study about the risk of vitamin D3 levels dropping after a surgery. 9. Clinical study about vitamin D3 for better outcomes in colorectal cancer. 10. Clinical study about impact of vitamin D3 on the colon tumor immune microenvironment. 11. Scientific study about the role of retinoic acid or vitamin A in colon cancer. 12. Observational study which reveals that multivitamins lower the risk of colon cancer. Role of vitamins A and D3 in cancer prevention. Did you know that the vitamins you consume play a direct role in how your genes behave and can even help prevent cancer? Vitamin A and vitamin D3 have a significant role in this regard. These aren't just ordinary nutrients. Both of them play a key role in gene regulation, especially genes that are involved in cell growth, repair, and protection against tumors. Vitamin A and cancer prevention. Vitamin A is essential for cell differentiation, which means it helps your cells know what they're supposed to become. This is super important because when cells lose this ability, they can start to grow uncontrollably, one of the early steps toward cancer. Vitamin A also regulates important tumor suppressor genes like APC and HOXA5. APC is a gene that acts as a brake to stop cells from dividing too much or growing in the wrong place. HOXA5 is a transcription factor that helps control normal cell development and suppress tumor formation. When there's a deficiency of vitamin A, these genes may not function properly, increasing the risk of colorectal cancer and possibly others. Now, let's talk about vitamin D3, also known as the sunshine vitamin. D3 is actually wrongly called vitamin. Instead, it's actually a hormone that does a lot more than just support your bones. It actually controls the expression of over 2000 genes in your body, including genes involved in immune response, inflammation control, and tumor suppression. Vitamin D3 helps regulate the WNT, beta-catenin pathway, which is a major signaling route in cells. When this pathway is overactive, it can lead to uncontrolled cell growth, which is a key feature of cancer, especially in the colon and breast. Vitamin D also enhances the function of the APC gene, just like vitamin A, so together, they form a kind of gene-protecting duo. Now, let's understand the therapeutic role of vitamin D3 in colon cancer. It has various functions in our body, such as cell growth regulation. Vitamin D3, through its active form calcitriol, plays a role in regulating cell growth and differentiation. In colon cells, it can help prevent abnormal growth and encourage normal cell behavior, potentially reducing the risk of cancer. Vitamin D3 also plays a role in suppressing tumor formation. It has been shown to regulate genes involved in cell cycle control, apoptosis, programmed cell death, and immune responses. These processes are essential for preventing the growth and spread of cancer cells. Vitamin D3 also plays a key role in enhancing immune function by stimulating immune cells to attack cancer cells. In colon cancer, this might help the body mount a more effective response to any cancerous growths. Vitamin D3 also inhibits metastasis. Some studies suggest that vitamin D3 may help reduce the ability of cancer cells to spread, metastasize, which is particularly important for advanced stages of cancer. One of the leading vitamin D expert, Angus Dalgleish, a professor of oncology at St. George's Hospital in London and author of 4 books and over 260 clinical papers, is one of a growing number of clinicians investigating the role of vitamin D in cancer prevention and treatment. Based on an observational study involving over 2,000 cancer patients, Professor Dalgleish advocates supplementing D3 in high doses, 10,000 U units and above every day, due to its significant role in regulating the immune system and in dampening the proliferation of cancer cells. His research found that higher levels of vitamin D3 had direct relation to higher recovery and survival rates among his cancer patients. Therefore, he recommends maintaining D3 levels between 80 to 100 nanograms per milliliter for optimum health, and to patients recovering from cancer, he recommends keeping their levels above 100. Only in people having renal failures or phosphate pathway problems, Professor Dalgleish recommends limited dosage of vitamin D3 or using the active form of vitamin D3 called calcitriol. The document shown here is a guest list of speakers from an old London conference on the topic of vitamin D and cancer treatment or prevention. This shows that Professor Dalgleish is not alone in advocating the role of vitamin D3. In fact, many leading oncologists, doctors and researchers have recognized this. Its deficiency is not limited to colon cancer alone. Its deficiency is associated with many other cancer types and other diseases such as osteoporosis, multiple sclerosis, diabetes, insulin resistance, hypertension, heart disease, respiratory infections, muscle weakness, mood and cognitive function, and infectious diseases such as influenza. There are hundreds of published studies available online that support that humans require very high levels of vitamin D3 for achieving and maintaining optimum health. Now let's understand the therapeutic role of vitamin A in colon cancer. Gene expression regulation. Vitamin A, particularly through its active forms like retinoic acid, plays a critical role in regulating gene expression. This includes genes involved in cell growth, differentiation, and apoptosis. It helps maintain normal cellular function and prevent uncontrolled cell proliferation that can lead to cancer. Antioxidant effects. Retinoic acid has antioxidant properties, helping to reduce oxidative stress, which is a contributing factor to the development of cancer. Lowering oxidative damage can help reduce the likelihood of mutations that could lead to colon cancer. Modulating cancer stem cells. Some studies suggest that vitamin A might target cancer stem cells, which are often resistant to treatments. By influencing the behavior of these cells, vitamin A could help prevent cancer recurrence. Now let's understand the importance of supplementing vitamin A and vitamin D3. In relation to vitamin D3, the observational study by oncology Professor Angus Dalgleish provides sufficient evidence that higher levels of vitamin D3 is needed. He recommends maintaining blood levels of D3 between 80 to 100 nanograms per milliliter. But for most people, these levels cannot be achieved without taking supplements, because people spend most of their time indoors, and even when they are outdoor, most of their body is covered with clothes, which prevents them from getting natural D3 from sunlight. Moreover, people who have darker skins like Indians and Africans, they cannot absorb D3 from sunlight. Darker skin tones contain more melanin, a pigment that absorbs ultraviolet (UVB) radiation. This absorption reduces the amount of UVB that reaches the skin's surface, where vitamin D is synthesized. While melanin protects against sun damage, it also hinders the production of vitamin D, leading to potential deficiencies in individuals with darker skin. Hence, supplementing D3 becomes necessary. Now let's understand why supplementing vitamin A is so important. From clinical studies perspective, this is a less studied vitamin in comparison to vitamin D3, but some clinical studies have clearly shown that retinoids, vitamin A derivatives, could have a role in reducing the growth of colon cancer cells. In fact, vitamin A in the form of all-trans-retinoic acid, ATRA, is already being used in high doses as a drug in the treatment of certain types of leukemia, particularly acute promyelocytic leukemia, APL, and also has applications in treating skin cancer. However, the exact role and dosage of vitamin A supplements for therapeutic use in colon cancers needs more research. But based on the findings of the clinical studies in understanding the significant role of vitamin A in reducing the growth of colon cancer cells, it would be prudent to supplement at least the daily RDA levels of vitamin A for minimizing the risk of colon cancer. You should definitely consider taking vitamin A supplements if your body gives the following signs, which are key markers in vitamin A deficiency. Dry mouth and mucous membranes. Vitamin A helps maintain healthy mucous membranes, and without it, your mouth, nose, throat, and even lungs can feel dry, irritated, or inflamed. Dry, rough, or scaly skin. Vitamin A promotes skin cell turnover. Deficiency can result in dry, bumpy skin. Other signs are night blindness, dry eyes. As vitamin A keeps your eyes moist, so deficiency can lead to dry, irritated eyes, and in severe cases, it can cause corneal ulcers or even blindness. Frequent infections due to low immune response is another sign. You may get colds, respiratory infections, or slow healing wounds more often. Vitamin A supports tissue repair and cell growth. Without enough, you might notice nail fragility, hair thinning, or hair fall. Severe deficiency may lead to corneal ulcers or permanent blindness, severe respiratory or gastrointestinal infections, and colon polyps and cancer due to vitamin A's essential role in keeping colon's mucosal barrier intact, preventing harmful bacteria and toxins from damaging the colon wall and causing inflammation or infection. Recommended dosage. In relation to vitamin A, the recommendation is based on standard RDA guidelines, which advises the following dosages for adults. For women, it is 700 micrograms per day, and for men, it is 900 micrograms per day. For blood test, the normal range is between 20 and 60 micrograms per deciliter. Vitamin A toxicity is generally considered when blood levels exceed 100 micrograms per deciliter. With regards to vitamin D3, experts recommend much higher doses than the RDA guidelines. They advise the following for achieving optimum health. For normal healthy adults with limited sun exposure or people with darker skin, the following is recommended. 5,000 IU to 10,000 IU per day. Adults over the age of 60, 10,000 IU to 20,000 IU. Adults with chronic health conditions or cancer patients may need mega doses, 20,000 IU to 50,000 IU, as levels deplete during sickness periods. Blood test level recommended for normal healthy adults, 80 to 100 nanograms or 200 and 250 nmol. Blood test levels recommended for cancer patients or people suffering from other serious illnesses, 100 to 120 nanograms per milliliter. It is to be noted that someone newly starting to take vitamin D3 may not see benefits immediately, as it takes 3 weeks for our body to convert D3 to its active form called calcitriol, that our body can use. Hence, for very ill patients who need vitamin D3 immediately, they are given D3 in the calcitriol form itself, as they start working within just 1 to 2 hours. Key consideration when supplementing vitamin D3. Blood tests should be carried out at least once or twice a year to ensure correct levels of vitamin D3 are maintained. D3 increases calcium absorption from food, which can get deposited in arteries. This can be avoided by taking vitamin K2, which directs calcium into the bones and teeth. Vitamin D experts recommend taking the following additional supplements alongside D3 and K2 for optimum health: magnesium, zinc and selenium. Dosage recommendation for all additional supplements is as follows. Vitamin K2, in the form as Mk7, 200 to 400 micrograms per day. Zinc 25 to 50 milligrams per day. Magnesium 400 to 420 milligrams per day. Selenium 55 micrograms per day. People with renal failure or other kidney issues are advised to take D3 in the form of calcitriol, as their kidney may not be able to convert D3 to this active form, which may lead to the formation of kidney stones. Now, let's understand the impact of gallbladder removal in absorption of fat-soluble vitamins. Role of gallbladder. It stores bile, which is produced by the liver, and gallbladder releases it into bile into the duodenum, the first part of the small intestine, to help emulsify fats, making them easier to digest and absorb. Bile also aids in the absorption of fat-soluble vitamins, which are carried in the fat and absorbed by the small intestine. Impact of gallbladder removal. After the gallbladder is removed, bile is still produced by the liver but is no longer stored in the gallbladder. Instead, it is continuously released into the small intestine in small amounts. This constant but smaller release of bile may be less effective at emulsifying large amounts of fat or fat-soluble vitamins, especially when large meals are consumed. So, this may impact the absorption of vitamin A, vitamin D, vitamin E, and vitamin K. So, over time, this could lead to deficiency of these essential vitamins. The solution to this problem would be taking bile salt or similar products with heavy meals to enable fat metabolism. So, let's look into how one may improve their fat metabolism if they do not have a gallbladder. Fortunately, there are a number of products available in the form of supplements and enzymes that can improve the metabolism of fat when heavy meals are consumed. Let's go through the list of such products. 1. Bile salts, bile acids. These can help to compensate for the reduced bile storage capacity after gallbladder removal. These supplements provide additional bile acids which aid in the emulsification of fats and fat-soluble vitamins in the digestive tract. 2. Lipase. This is an enzyme that helps break down fats into fatty acids and glycerol, facilitating their absorption. 3. Digestive enzyme blends. These are supplements that contain lipase, protease, and amylase. These can also support overall digestion and enhance the breakdown of fats, proteins, and carbohydrates. 4. Medium-chain triglycerides, MCT, oil. This is a type of fat that is easier to digest and absorb than long-chain fatty acids. MCTs are absorbed directly into the bloodstream, bypassing the need for bile. 5. Vitamin E, mixed tocopherols. This can sometimes support digestion by acting as an antioxidant and promoting overall gut health. 6. Lecithin. This is a phospholipid that can help to improve fat digestion. It works by breaking down fats into smaller particles that can be absorbed more easily by the digestive system. 7. Probiotics. These contain beneficial bacteria which can help improve gut health, which can indirectly enhance the absorption of all nutrients, including fat-soluble vitamins. Now, in order to back all the information provided so far in this video, I will now provide the evidence from some clinical, preclinical or observational studies that have studied the role of vitamin D3 and vitamin A in cancer. I'm starting from a clinical study that discovered the risk of vitamin D3 levels dropping after patients undergo a surgery. This clinical study was conducted by Cancer Research Edinburgh, UK, and it has revealed that vitamin D3 levels drop significantly after colonic surgery, and the levels can remain low for a very long time after the surgery. Study findings. This study involved 92 patients undergoing colorectal cancer surgery, with larger survival data analyzed from 2 additional cohorts of 2,006 and 2,100 patients. Researchers found that vitamin D3 levels dropped significantly after the surgery and remained lower for up to a year. Importantly, higher vitamin D3 levels were strongly associated with better survival outcomes, including a 31% lower risk of colon cancer-related death and a 32% lower risk of death from any cause. These findings highlight the critical importance of maintaining adequate vitamin D3 levels after surgery and support the rationale for conducting clinical trials on vitamin D supplementation as a potential strategy to improve survival in cancer patients. The link for this study is provided in this video if someone wants to read all the details. The next clinical study looks at the role of vitamin D3 for better outcomes in colorectal cancer. This clinical study was published by Department of Cancer Biology in Spain. It highlights the significance of vitamin D3, especially the active form called calcitriol, in fighting and slowing down colorectal cancer. Study summary: 658 people with colorectal cancer were studied to see how vitamin D3 affects the cancer's outcome. They focused on a special protein called the vitamin D receptor, VDR, which is found in the tissue around tumors, known as tumor stroma. First, let's try to understand what is VDR or vitamin D3 receptor. VDR is like a switch inside cells that gets turned on by vitamin D3, specifically through its active form, called calcitriol. Once the VDR is turned on, it helps control how certain genes work, including those that may fight cancer or slow cancer growth. So, what did they find? Well, they found that people whose tumor-supporting cells, called fibroblasts, had high levels of VDR, lived longer and had better recovery. Vitamin D made these fibroblasts less supportive of cancer growth. A gene signature controlled by VDR was linked to better survival and less chance of the cancer coming back. These good effects were seen even if the cancer cells themselves didn't have VDR, which is important. Why does this matter? It matters because vitamin D, the third of, may help fight colorectal cancer by acting on the cells around the tumor and not just the tumor itself. This means that keeping healthy vitamin D3 levels could be important in preventing or slowing down colon cancer. It also opens up the possibility of using VDR-based treatments like vitamin D supplements or similar drugs for better cancer outcomes. The link for this study is provided in this video if someone wants to read all the details. The next clinical study looks at the impact of vitamin D3 on the colon tumor immune microenvironment. This clinical study was published in Scopes.org. It suggests that high-dose vitamin D3 supplementation may enhance immune response and help the body target colon tumors more effectively in patients with early-stage cancer. Study background: a number of researches previously done had shown that vitamin D has anti-tumor properties in colorectal cancer. So this study was carried out to focus more specifically in assessing vitamin D's effects on the immune response in CRC patients. So, for this study, a randomized placebo-controlled trial was conducted with 42 patients with stage 1 to stage 3 colon cancer. Participants in this trial received 50,000 U per day of vitamin D3 for 7 days, followed by 10,000 U per day, or a placebo prior to the surgery. Out of 42 patients, it was 19 patients who completed the treatment and had sufficient tissue for analysis were included in the final evaluation. So, what did results show? The key finding of the results is that vitamin D supplementation helped increase certain immune cells, specifically CD8 plus T cells, which are important for fighting cancer, and made these cells work closer to the tumor. It also changed how some proteins related to vitamin D were expressed in tumor and immune cells, possibly making the immune system more effective in attacking the tumor. So, the final conclusion of the study was that taking vitamin D before surgery in patients with early-stage colon cancer seems to help the immune system by increasing certain types of immune cells that can attack the tumor. Vitamin D also changes how certain proteins are expressed in tumor and immune cells, suggesting it might have an anti-cancer effect by improving immune responses. The link for this study is provided in this video if someone wants to read all the details. This next study looks at the role of retinoic acid in colon cancer. Retinoic acid is a metabolite of vitamin A. This study was carried out by scientists at Christiana Care's Helen F. Graham Cancer Center and Research Institute, and this identifies that there is a link between the retinoic acid signaling pathway and another pathway critical to tumor development. Based on this study, vitamin A supplementation, particularly through retinoids, may offer benefits in colon cancer treatment by supporting the retinoic acid (RA) pathway, which regulates stem cell maturation and tumor development. The key findings of this study are as follows. 1. Regulating stem cell maturation. Retinoids help mature colon stem cells, preventing them from staying immature and overpopulating, which contributes to cancer. 2. Balancing pathways. Vitamin A may help normalize the RA pathway, counteracting the overactive WNT pathway to stop tumor growth. 3. Slowing cancer growth. Retinoids can slow cancer cell growth and spread by supporting the RA pathway. 4. Drug development. Retinoid-based drugs have shown promise in treating other types of cancers and could also target cancer stem cells in colon cancer. 5. Boosting immune function. Vitamin A supports immune function, which may help the body eliminate cancer cells. This study clearly shows that vitamin A has a critical role in treating cancer. More research is definitely needed to fully understand the role of vitamin A in colon cancer therapy. But patients could benefit from supplementing it under medical supervision. It may also be necessary to monitor the levels of vitamin A in blood to prevent levels reaching the toxic range. The link for this study is provided in this video if someone wants to read all the details. Lastly, I will talk about an observational study that looked at the role of multivitamins in reducing the risk of colon cancer. This old research from 1997 is published on PubMed. NCBI, it reveals a positive link between regular multivitamin supplementation and lower risk of colon cancer. This study was designed to look at adults aged 30 to 62 in the Seattle area of USA to see if taking vitamin supplements affected colon cancer risk. It included 251 men and 193 women with colon cancer and 427 people without cancer for comparison. Research findings are as follows. It was found that people who regularly took vitamin A, vitamin C, vitamin E, folic acid, calcium, or multivitamins over a 10-year period, they had a lower risk of developing colon cancer. Strongest protective effects was found with vitamin E in doses 200 IU or more per day, as it was linked to 57% lower risk of colon cancer. Daily multivitamin use was linked to 51% lower risk of colon cancer. These results were consistent even after adjusting for age, gender, and lifestyle habits. Vitamin D's effect couldn't be studied separately because it mostly comes from multivitamins, but nevertheless, this study highlights that vitamins play a significant role in keeping our immune system strong. The link for this study is available in this video. This video is not a medical advice. It is intended to empower you to ask the right questions when you speak with your doctor. Many doctors aren't trained in nutrition, and they may not always be up to date with the latest research and clinical studies on the role of vitamins and minerals in overall health. So, it's worth asking, could the root cause of your poor health be a deficiency in key nutrients? Our bodies have an incredible ability to heal themselves. When a bone breaks, the doctor simply puts a cast to keep it aligned. The actual healing is done by the body. In the same way, when you correct nutritional deficiencies through a proper diet, supplements, and healthy lifestyle changes, you are giving your body the tools it needs to repair and restore itself. That brings us to the end of this video. Thank you for watching, and take charge of your health.